So before entering the patient's room, we would have performed our hand hygiene. So we'll start by doing a general safety check, just making sure there's no hazards on the ground, nothing that they can trip on, as well as our patient doesn't look like they're in any distress, as well as equipment functioning properly around them. So just for the purpose of this video, I'm just going to sit so you can see me better. But we'll start by introducing ourselves. So hi, my name is Sarah Kennedy. I'm a student nurse from the University of Manitoba. I'm just here to give you your medications for today. Can you tell me your name? So you're just going to make sure they verbally tell you their name, as well as can you tell me your date of birth? And they'll tell you their date of birth. You just want to make sure what they say matches what you have on the MAR in your meds. So you just want to check their armband next to make sure that their name again matches the MAR, as well as that FIN number and the date of birth, which it does, so we're okay. And can you tell me if you have any drug allergy or any allergies? So they tell you their allergies, and you just want to make sure that matches up with the MAR. So yeah, you don't have any drug allergies, but you do to environmental irritants. Yeah, we have that too. Perfect. So Elaine, today we'll be giving you your medication, or we'll be giving you some medications. So I just want to take a moment to review that. So this is when you'll be doing your third check. So we have our right patient, like we just checked at the beginning. So again, we have we're checking it with the MAR and our prepared meds. So we have Elaine bowing for right patient. We have the furosemide for the right drug, furosemide. For the right dose, 60 milligrams. We have 60 milligrams here because we have 3 20 milligram tablets. Right root, oral, right time and frequency daily. We're giving her that at the 1000 hours. And we haven't given it to her at any other point today, so that's okay. Next, we'll be giving enalapril. So we have right patient, Elaine bowing. We have the right medication, enalapril. We have the right dose. We have 10 milligrams, and then we have 2 tablets here of 5 milligrams each, so that equals 10. Root, oral, or for right root. Time and frequency, we have twice a day, but we're giving her that at the 1000 hours now. Next one, we have diphenhydramine syrup. So we would have Elaine bowing, diphenhydramine syrup. We need 25 milligrams for the right dose. We have 10 milliliters with a concentration of 12.5 milligrams per milliliter, so that will equal our 25. Right root is oral, time and frequency every 4 to 6 hours PRN for their pruritus. So again, that is, we're giving her that when we needed, so that's at the 1000 hours there. So we'll start with the right to patient education. So Elaine, I'm just going to tell you a little bit about your medications you'll be getting today. So the first one is just for when they take the medications, you want to make sure they're sitting upright in bed so that's easier for them to swallow. So we'll be giving you the furosemide of 3 tablets of that, and that's for your edema. So side effects with that can include headache, fatigue, cramps, nausea, as well as what we call orthostatic hypertension. So you just want to make sure you're not getting up too fast from a lying or sitting position to standing. So just make sure you're moving nice and slowly. So before giving you that, we'll be doing your vital signs, specifically your blood pressure, as well as checking for any your lung sounds for any crackling. So we'll be doing the blood pressure as well as the lung sounds before and after. As well as afterwards, we'll be checking your intake and output So we'll be checking the fluids that go in versus what you put out. We can be looking for a daily weight as well as electrolytes, just to make sure everything's nice and safe after you take the drugs. If you experience any of those side effects I mentioned before, please just let me know. So you should take that with the water and then just make sure she's swallowed. So next is we'll be getting your enalapril. So we'll be getting 2 tablets of that, and that is also for your edema. Side effects with that can include insomnia, dizziness, dry cough, as well as that hypotension that I mentioned before. So just being sure you're nice and slow when you get up. So again, before and after, I'll be looking for your blood pressure, as well as I'll check your renal function afterwards. So you'd give her that, like you would have done the assessments before giving her the medications that you needed to. So the next is the diphenhydramine syrup. And you just want to make sure she swallowed that, is the diphenhydramine syrup. So that'll be oral as well. So you're taking that for your pruritus. So side effects with that can include blurred vision, dry mouth, drowsiness, dizziness, urinary retention. So we'll be looking for your respiratory rate after you take the medication, as well as that intake and output to make sure to see if you're retaining any fluid. And we just want to make sure your pruritus is going away, so we'll obviously be looking for that as well. Giving her that. Okay. And again, before we would have given her each of these medications, we would have done the monitoring that I mentioned beforehand. So like if you needed to do the blood pressure, you would have done the blood pressure before. So just making sure we have the right assessments before we give the drugs we need to. So that includes the blood pressure and any other vital signs. So right after we've done that, we want to have the right documentation. So we want to list the time with our initials and our designation after each drug that we've given. So with the furosemide, we write 1000 hours with my initials SK and UMSN 2, so that's on the MAR. So we've written that. And then we have enalapril, so again 1000 hours SK UMSN 2 on our MAR. And then we have the diphenhydramine syrup at 1000 hours SK UMSN 2 on our MAR. Perfect. So now that we're done with that, we just want to make sure the patient's nice and safe and that they don't need anything else. So you're going to put their call bell beside them. Let them know to call you if they experience any of those symptoms or need any help. Okay, so again, as mentioned before with the monitoring of those drugs, we're going to come back in 30 minutes just to check on those oral medications. And we can assess the blood pressure as well as throughout the day we can look for that intake and output like I mentioned before, and any labs for renal function as well. We can also check her daily weight just to see how those fluids are doing, because I know there's the urinary retention with the diphenhydramine, but there's also a lot of fluid outtake with the enalapril. So we just want to make sure that she's still retaining fluid and isn't getting dehydrated. And yeah.